Counterfeit medicines have been finding their way onto the market in most of the countries on the continent. This has endangered the lives of many patients. We're joined now by Professor David Katerere, Research Platform Chair for Pharmaceutical and Biotech Advancement in Africa at Tshwane University of Technology, for more on this. Thank you very much, Prof, for your time this afternoon. Perhaps let's start with a little bit of background. Just how bad is the situation?
Well, the situation is quite bad, and actually it's a global situation. Recently in the US, they also found that there were some substandard or counterfeit products, eye products actually, that resulted in some people going blind. In Africa, it is quite a bad problem. We have 1 in 10, so anything between 10% in some countries up to maybe 80% in some countries of medicines that are being sold would be considered fake medicines or substandard.
Is this a continent-wide problem, or are there some countries that are struggling with it more than others?
Yeah, so there would be certain countries that would struggle more. What counterfeiters also tend to do is obviously they go to places where they are not easily detected. So where regulatory agencies are weak, and also where public awareness of counterfeits is not so good. So for instance, with products like anti-malarials, they are quite easy to counterfeit and fake. So you do get a lot of fake antibiotics, fake anti-malarials. And then in the sort of more well-to-do markets across Africa, it would be products that come through online pharmacies, which are generally unregulated, and we actually sometimes don't know where these pharmacies reside.
Yeah, and that was my next question. How is it that they're able to make their way into the continent? Are some of the fake products manufactured here? Well,
not really. India and China are really the source countries for most counterfeit goods. So remember that fake medicines are just part of this billion-dollar industry of fake counterfeit goods. So they are, infiltrating from foreign markets, as it were. So in our countries, the major problem might be poor quality medicines. So there are kind of two legs to what we call counterfeit or substandard products. The one is fake medicines, where people have deliberately faked the medicine. And in some cases, normally they have a really nice package, but then what's inside could either be have no therapy at all, or sometimes it is toxic. And then you have on the other side products that are poorly made, or what we call substandard products. You mentioned that public awareness is quite weak, or included regulatory frameworks in the country governing the movement of these medicines. But when we talk about public awareness, how would the layperson know that what is on their table or in their hands is actually counterfeit? Yeah, okay. So these kind of engagements that we are having are very important, because like if you go to the supermarket and you buy bread, what do? You actually inspect it. You will say, okay, it's best before this date. Sometimes, maybe it's got an off smell. So people should be familiar with the products or the medicines that they use. And especially for those that, use medicines every month, what we would call chronic medicines. And you need to kind of inspect that they are not tampered with, the packaging itself. You need to also inspect the actual tablets or capsules or liquids as you take them. And if you suspect that there's something off or something that you cannot understand about these products, then you should contact your pharmacist, or contact, in the case in South Africa, SAPRA is very progressive around trying to weed out counterfeits where they are, if they do occur, or substandard products.
Prof, while we appreciate that this is a worldwide problem, how do we then tackle it head-on on the continent? China and India, that you mentioned to be some of the biggest importers of these medicines that are not fit for purpose, they are our BRICS partners. Is there anything that governments on the continent can do to put pressure?
Well, it's just to have better regulatory systems. A lot of regulatory systems are weak because we don't have enough people. So in terms of capacity, sometimes the people are not trained enough, and they normally work with border authorities as well. So regulators do need to have presence at borders, and then the whole value chain. So for instance, WHO now is focusing a lot on how do you train pharmacists, who are like at the coalface. So how do you train them to be able to identify fake products and take those out of the supply chain? But at the end of the day, the consumer is really the person who makes that decision, because the consumer can decide to go and buy medicines in unconventional spaces, right? Because maybe it's cheaper, or because they want to treat diseases, let's say like, sexual dysfunction, where they might be embarrassed to go to conventional health care services. So it's important that the consumer takes a huge level of responsibility in guarding against counterfeits.
Are we producing on the continent enough medicines that are within a comfortable price range, so people don't find themselves in this position where they go to nefarious spaces because it's much cheaper?
Yeah, so it's interesting because post-COVID, we've started to see a lot of interest in what we call production on the African continent. So you may know that, for instance, Moderna is now setting up in Kenya. There's a lot of interest in producing in South Africa as well. So yes, so governments actually need to come to the table and support all the different initiatives that are going on. So at SADC level, there are certain initiatives which are aimed at industrialization and supporting a local manufacturing. So I think that's a very, very important point that you make, so that we are less prone to some of these cheap imports that may be hazardous to health.
Thank you very much to Professor David Katerere, Research Platform Chair for Pharmaceutical and Biotech Advancement in Africa at Tshwane University of Technology.